Dr. Ali Khan, thank you for joining me today. I'm so excited. You're going to be giving us tips and advice on Medicare enrollment and healthy aging. Today is the beginning of Medicare enrollment. I want my audience to know. So listen and listen close. You might get some great information. Dr. Khan, once again, thank you for taking the time to be here.
Thanks for having me, Valder.
Before we get into the enrollment, you got any top tips on healthy aging?
I sure do. I'm a practicing primary care doc here in Chicago, a practice here on the West Side. And where I really try to emphasize my patients are three main things. Number one, really take prevention seriously. And we talk a lot about mammograms, colonoscopies, those are important. But sometimes the basics are what really matters. One of the best things we can do to prevent the onset of dementia is getting a hearing test and a visual test, an eye exam every single year to make sure we catch things before they become problems. And so those are crucial services, which is why we're really proud at Aetna Medicare to make sure those are done with no cost to the audience. Second is really focus on physical activity. 30 minutes a day of whatever, floats your boat, be it pickleball, be it running, be it weightlifting, whatever, be it walking. But that helps your heart health, that helps bone health, that helps reduce the risk of falls, all the things we want to make sure we're taking care of as we get older. And third, make sure you're connecting to a community, right? The health effects of social isolation and loneliness are real, especially for seniors, but really for all of us. And so whether it's a bowling league, whether it's a book club, whether it's, a knitting circle, whether it's a pickleball league, whatever it could be, right? Chess or checkers, making sure that you're connected in to a community that you see regularly, that you engage with, you have a real network, super important for living your best life.
That's some great advice. But what if you don't have a community of people? You live alone and you've got very little family in the area. What happens to those people?
I think this is where Medicare Advantage can be really helpful, Valder, right? So in many of the plans that we work with, that we offer at Aetna and that, I work with as a physician, the plans are actually working on extra benefits, right? To enable folks to get connected, right? Pairing them with community health workers or with social navigators, enabling them to join other resources in the community, plugging them into fitness classes where they can meet folks or other social activities, right? That's the kind of wraparound work of wellness and connection that traditional Medicare just doesn't do, right? So I find that that's where that building that ecosystem and having a health plan to partner with you to build that ecosystem and to help you know where to look becomes really critical.
Tell me, what is Medicare AEP Essentials? What does that mean?
Yeah, so AEP stands for the Annual Enrollment Period, which happens from October 15th to December 7th of every year, where anyone who's eligible for Medicare can look around, do research on what plans are available to them, and make good choices, right? And it can be a very confusing time, so I try to keep it simple for my patients. Number one, what's the plan that you can afford, right? Number two, when you think about your favorite doctors, hospitals, pharmacies, and the like, are they in network with that plan or are they out, right? And third, what are the prescription drugs that you take and does the plan cover them at what cost? And this is a really important one, right? Because Medicare Advantage plans cover prescription drugs, which is something that traditional Medicare doesn't do. So understanding what your overall cost is going to be is really critical in terms of thinking about how to make decisions that are right for you.
That's very, very interesting. We put out a post that I would be speaking with you, and we found a large number of our responders thought they had an Advantage plan, but they just have traditional Medicare. How do we delineate that for them?
One thing they can always do is visit us at aetnamedicare.com, and we can help in terms of helping identify what kind of plan they're on today. But to keep it really simple, traditional Medicare we all know and love. Medicare Advantage covers the things that traditional Medicare covers, but it offers a few extras. The first is really on affordability. Valder, in Medicare Advantage, you have a maximum out-of-pocket limit that you will be spending no more than this in a given year, which traditional Medicare just doesn't have. So there's that predictability piece. Second is the prescription drug coverage piece, which Medicare Advantage does that traditional Medicare doesn't, that we talked about earlier. And third becomes those extra wraparound benefits, right? If you're living alone at home, or if you're interested in getting more fit, or if you've got other wellness goals, those are benefits that we in Medicare Advantage build that traditional Medicare doesn't. So there are lots of variables that can be very confusing, but when I think of those three, those are the big three in terms of differentiating traditional Medicare from Medicare Advantage.
And finally, Dr. Khan, how do they select a Medicare plan that fits their individual needs? And you did touch upon some of those, the drugs and all of that. One of the things I found out in my little bitty world, they don't understand about the components of drugs and the components of covering your doctor visits. Can you speak on that a little bit?
This is where I think, again, it can be very confusing, and we have to do right by our folks who are Medicare eligible to make sure that they have the help that they need to make these decisions. AetnaMedicare.com is a great place to do that. You can obviously find out a bunch of information on the internet about what your options are for coverage, help answer questions about what matters to you, and then connect with folks, whether it's call center agents on our Aetna side or other partners in the community who can help explain, given your choices and your options, what plans make the most sense for you. We'd obviously love to serve you at Aetna Medicare, and so we've got a bunch of options as well. But it's connecting you not only to information, but to the humans who can help you make those decisions and get you into the right place. So AetnaMedicare.com is a really great place to start because all of us owe it to anyone, no matter what they choose, to do the work of demystifying.
I want my audience to know I've been speaking with Dr. Ali Khan. He's the Vice President and the Chief Medical Officer for Aetna Medicare. Dr. Khan, you have had such logical and clear information. I'm so impressed by you. I want to thank you for stopping by the Valder Beebe Show.
Valder, thanks so much for having me. Y'all have a great day.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebe Show and stay connected as I interview the world's most fascinating people.